morning, Vicky, and welcome to your Spirometry practical assessment. Before we get started, I have just a couple of things to run through. So your practical assessment will take about 20 minutes. Then following your practical assessment, we'll do a clinical viva, which will be a series of questions, and that will take approximately 10 minutes. During your assessment, you will only be expected to perform 3 manoeuvres for VCs and FVCs. Okay. Do you have any questions?
No, not at the minute.
Good. Okay, so I will act as your assessor and your patient subject. And first of all, what I would like you to do is run through how you would set up your spirometer so you know it's working correctly and you're happy to test with it.
Okay, so I can see you've got a calibration syringe there, which is probably a 3-litre one. I'll look at the length of it. So I would verify or calibrate, depending on what my equipment does, the machine first. I'd also do carry out some infection control procedures. So I'd make sure that the area was clean and use Clinell wipes to wipe everything down, hand wash, alcohol gel, whatever I've got available from that point of view as well.
Okay. Okay, so from this point, I'm going to share my screen with you. I appreciate you probably don't know how to use this equipment if yours is different, which is fine. So if you have any questions, then I'll be able to prompt you in the right direction. Okay. So can you see my spirometry program?
Yeah.
Good. Okay. So first of all, what would you like to do?
So first of all, if we can verify this spirometer, please.
Okay, yeah. Can you confirm that this is a 3-litre syringe?
Yeah, and it says 3 litres on the screen, so that's good.
Okay. So I've now connected the flow head onto the syringe for you.
Fantastic.
And are you happy with the temperature?
So was the syringe kept in the same place as the spirometer? Yes. And the temperature's shown on there. Okay, 24, warmish.
Okay.
Okay, so yeah, go on.
Yeah, so how would you like me to proceed?
So what I would normally do is do 3 different flows, a low flow, a medium flow and a high flow. Does yours require that, or?
Flow rate doesn't matter, it's just volume on this type of spirometer.
Okay, so I would do it at 3 different flows anyway, so we'll go for that. So what I would do is I would pull out the syringe all the way nice and smoothly and push it all the way back in nice and smoothly. And to start with, I do a flow rate maybe of 1 to 2 litres per second, if you're able to do that.
Okay.
So when you're ready, pull it all the way out smoothly, all the way to the end, and then push it all the way back in smoothly. Lovely. And that says 3.08, so that's on the edge. I'm allowed up to 3.09 for my 3%, so I'd be okay with that. So I'd move on to the next flow rate. So I'd do the same thing again, but maybe between 2 and 4 litres per second this time, if you can pull it out smoothly and push it back in all the way. Lovely. So 3.04, I'm happy with that. So I'd move on to the higher flow rate, which would be perhaps between about 6 and 8 litres per second. So if you could do the same thing all the way out and push it back in a bit faster this time.
Okay.
Not quite as fast as it normally do, but I might let you off.
Sorry.
Can you move the that box over a bit so I can just have a look what the last one was?
Okay.
I know it says it's fast, 3.01, great. So I'd be happy with that.
Yep, good. Okay. Okay. So for the next part, I'd like you to treat me like you would a normal subject, patient subject, and run through a spirometry test like you would normally. You'll be able to obviously see my efforts and you'll be able to review the results on the screen as we go along. Okay. So If you'd like to start how you normally would with a patient.
Okay, so normally on a face-to-face, I would call them in from the waiting room. So I'd say, Joe Purvis. I'd check obviously your name was correct, your date of birth, and usually the first line of your address. Have you got like a demographics page? Great. Yeah. So if we fill that in with us here, so gender, I'd check what the birth gender was. Yeah. Female. Pop in first name and surname. Population, look Caucasian for you. Date of birth. Okay. And then normally I do your height and weight. So for this, I would do shoes off. And for the weight, I'd make sure they weren't wearing any big coats or things like that might weigh something. So if we did the height first, so shoes off, you would do it using a stadiometer with the feet together. For us, it's heels back against the wall on some things or against the plastic bit of the stadiometer. And then tall as they can, eyes looking straight forward. Yeah. Do you know your height?
Yep. And what about the weight?
And the weight, so I would do the same thing, shoes off, no big coats on, etc., and do the weight in kilos for that. If you know yours.
Yep.
Okay, great. So in the notes, I'd probably check my pre-test questions and my contraindications, so I could write anything in there if that would be appropriate to do now. Yeah. So I'd make sure that you're wearing, loose-fitting clothing so that you're okay to do the test. Yeah. You're fairly comfortable, so that's good. And then any vigorous exercise recently?
No.
No. Any large meals recently?
No. Any
alcohol recently?
No.
I don't think by the look at you, you've got dentures, so no loose dentures.
And my teeth.
Great. Are you a smoker at all?
No.
No. So I'd pop in there non-smoker. If they were a smoker, I'd ask them when their last cigarette was, and perhaps pack years I'd work out as well. Do you take any inhalers at all?
No.
No, so no inhalers. Again, if they're on inhalers, I'd write down what they're on and when they last took them. Okay, so any recent chest infections?
No.
No. Any coughing up blood recently?
No.
Any heart or blood pressure problems that you know of?
No.
No. Any operations on your chest area or eyes recently?
No.
No. Any blood clots anywhere?
No.
No recent heart attack, stroke?
No.
Anyone told you recently you've got something called a pneumothorax or an aneurysm?
No, neither.
Great. So any sickness or anything today?
No.
Any other reason you might be able to do some breathing tests today?
No.
Great. So if there was a problem, we'd discuss that. If there were any issues, if I had access to blood pressure monitor, I might take their blood pressure or find out, if they're on tablets, etc., etc. But I think we're all good to go.
Good. So you're happy to proceed with the test?
I'm happy to proceed. You're here today for a breathing test. Are you happy to do a breathing test with us today?
I am, yes.
Brilliant. So what I would do first is a steady vital capacity. If we can click on that. Okay, so what we're going to do is I'm going to get you to take the biggest breath in that you can manage, right to the top, really fill your lungs almost till it hurts. And then I want you to pop your teeth and lips around the mouthpiece that we're going to sort out in a moment, and then blow out steadily all the way until you cannot blow out anymore. And I'm going to tell you what to do and when to do it, so you don't need to remember that.
Okay, good.
Okay, so have you got a mouthpiece there? And
I have, yeah. Is there anything else I might need?
Have you got a nose peg?
Yes.
Great.
Yeah.
Lovely. So what we're going to do, because it's all breathing through your mouth, I'm going to ask you to pop the peg on your nose. Then when you take your big breath in, take it all through your mouth. Then the teeth and lips round and blow out through your mouth as well. So, okay.
Yeah. Is there anything regarding the patient you would make sure they're doing?
Are you sitting up nice and straight? You look like
Yes.
you are. Have you got your legs uncrossed?
Yes.
Brilliant. So if you can pop the peg on your nose for me. Are you sitting in a chair with arms, actually?
Yes, I am. Yes.
Lovely. Pop the peg on your nose. And if you can take the biggest breath in you can manage now for me. Breathe in, teeth and lips round and steady blow out. Keep on going, blow, 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 blow. Stop when you can't anymore. Well done. If we can accept that, and then if I can have a look at the volume time graph.
Yeah. Okay.
Lovely. So I've got a nice plateau on there suggesting that you've blown out all the way. And I can see my VC of 4.26. So what I do now is I'd ask you if you're okay. Are you okay?
Yes, thank you.
Great. And I'd wait at least 30 seconds before I do another one. And then what I'm going to say is, so we're looking to do at least 3 of these, hopefully getting 2 reproducible ones. Are you okay to do another one?
I am, yes.
Great. You're still sitting up, legs uncrossed, nice and straight? Great.
Yep.
Nose peg on for me. And then when you're ready, biggest breath in. In, and steady blow. Keep on blowing, 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 keep on blowing. Stop when you're ready. Lovely. If you can accept that one.
Yep.
So it looks like you plateau fairly early. Is that normal for you?
Yes, it is.
Got nice elastic lungs, I think. Good. So we've got a 4.26 and a 4.11. So the second one wasn't quite so good, which might have been that you're just not quite getting as much air in as the first one. So we'll just really try and squeeze the air in, because the more we breathe in, the more we can blow out. So we'll try that for the last one.
Okay.
They're still within reproducibility though, so that's good. So how are you feeling? You okay to do another?
Yep, good, thank you.
You can pop the peg on your nose, still sitting up straight, legs uncrossed, and really big breath in, as big as you can. In, steady blow. Steady blow, steady blow, steady blow, steady blow, steady blow, steady blow. Stop when you're ready. I think that might have been a fast blow rather than a steady blow.
It was, I'm sorry, my fault.
So wasn't quite so good. So generally, because that was a fast one, and you can see that on the volume time, I'd probably have got rid of that and then had a rest and done another slow one. You said we were only doing 3. Do you want to do any more?
No, 3 is fine.
Okay. So at the moment, you've gone down on each go. So actually, I may not want to do any more on the patient if that was happening, if I would ask them how they were feeling, whether their chest felt tight or anything as well. But the 2 highest ones at the minute are reproducible, so I'm happy with that.
Okay, good. Okay, so what would you like to do now?
So go on and do the forced blows now. So we've done the steady blows. So we had a look at how much air you can blow out all the way. So now we're going to do the same thing, but this time when you take your really big breath in, I want you to use all the muscles in your chest to blow out as hard and as fast as you can, and then keep blowing till there's no air left at the end. And again, I'll talk you through it and what to do. Is that okay?
Yeah, good. So it's ready when you are.
Are you still sitting up straight, legs uncrossed?
Yes.
Okay, peg on your nose then, please. And really big breath in for me, big as you can manage. All the way in, blow. Keep going, keep going, keep blowing, keep blowing, keep blowing, blow, 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 blow. Stop when you're ready. Well done. So again, we get that plateau quite early. So if you can accept that. So on your volume time, it looks as though there's a little, it could be slightly early termination. It looks a little bit light, but I think it's just because you've got nice elastic lungs.
Did I plateau sufficiently?
You plateaued sufficiently. Let's have a look. You went from, so ideally we want less than 25 mils in a second, which is what it looks like on there. And the volume, the flow volume, sorry, isn't a straight down, like you just suddenly stop blowing. It does have a slight curve on the end of it, so I'd be happy with that. If we look at the FVC, it's also slightly better than the VC that you got. So, but
yes.
reproducible. So,
yeah,
that's good. So, again, I would have waited the 30 seconds, which we probably have now already. So, are you feeling okay to do another one?
Yes, I am.
Up straight, legs uncrossed.
Yep.
Nose peg on. We're going to do the same thing again, a fast one. So, when you're ready, really big breath in. In. Blow. Keep going, keep going, keep going, keep going, keep going. Blow, 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 blow. Stop when you're ready. Well done. Okay.
Would you accept that?
Yes. So I can see, in fact, you can hardly even see the two loops on the flow volume curve because they're identical and the volume time. So that's, and if we look at the numbers, they are almost identical as well. So very happy with. I can see that the peak flow is similar, but can you just scroll down so I can see the peak flow? Or just a minute, you know, down there somewhere, isn't it?
There you go.
So almost identical on the peak flow as well. Great. So we're looking for one more good blow, just like you've done. How are you feeling?
Yeah, good, thank you.
Sitting up straight, legs uncrossed still?
Yeah.
Nose peg on. And when you're ready, biggest breath in. And blow. Keep blowing, 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 keep blowing. And stop whenever you're ready. Well done. Brilliant. So I'd accept that. So yet again, it's almost on top of the other two. So we've got a slightly better peak flow. You can just see that on the flow volume. The highest two are within 40 litres per minute. So that's brilliant. The highest two FEV1s are within 40 mils. So again, excellent, well within the 5%.
Yeah. And
the highest two FVCs are within 60 mils. There is a 180 mil difference between the VC and the FVC. That's still within 5%, so I'd be happy with that as well. So overall, you've done 3 good blows. The highest two, well, all of them are reproducible actually, but the highest two are definitely reproducible. So I would say that would be the end of the test. We'll review the results and write a little report, and they'll go off to whoever's looking at them to give you the results.
Good. Can you just talk me through the trace, exactly what you're looking for on acceptability?
Oh, yeah. So on the volume time, I'm looking for a plateau at the end. So less than 25 mils in a second. I'm also looking for no slow start. So like an S-shaped curve, which you can see on both graphs. You can see a hesitation, slow start. So I don't want any of those. The back extrapolation volume, I'm looking to be less than 5% of the whole FVC. And again, you'd see that as a little blip on the flow volume, or like an S shape on the volume time. Yeah. I'm looking for a sharp rise to the peak flow, nice sharp rise, and nice smooth, no coughs, no sticking the tongue in the hole or interruptions in flow, nice and smooth all the way to the end, reaching the x-axis on the flow volume and a plateau on the volume time.
So that's the end of your practical assessment. Now I'm just going to ask you a few questions. So first of all, please can you define peak expiratory flow for me?
Okay, so peak expiratory flow, PEF, is the maximum flow achievable when you've take from a position of full inspiration. So when you breathed in all the way to total lung capacity, you blow out as hard and as fast as you can. It's that peak flow that's achieved usually within the first 100 milliseconds of the blow.
Thank you, Becky. That brings us to the end of your spirometry practical assessment. You should hear shortly, within the next 7 working days, about the outcome of your assessment, and you should receive that by email notification. So thank you very much and take care. Bye.
Bye.